Serena Williams' harrowing near-death experience after the birth of her first daughter, Alexis Olympia Ohanian, in 2017 has resurfaced in light of recent backlash over a tweet that blamed Black mothers for their own mortality during childbirth. Research has long shown that the maternal mortality rate for Black women is alarmingly higher, nearly double that of white women. According to a 2021 report by the Centers for Disease Control and Prevention, for every 100,000 live births, there were 70 deaths among Black mothers. On September 18, Joel Berry, managing editor of the Christian satire site The Babylon Bee, sparked outrage with a since-deleted tweet that read, "My wife is a labor and delivery nurse, and I can tell you with certainty that their mortality rate is higher because they refuse to get prenatal care, they take drugs at a higher rate, they refuse to eat the right diet, and they overall take worse care of themselves." Post ignited a storm of criticism, with many pointing out the dangerous stereotypes and inaccuracies in his statement. Outraged defenders of Black women were swift to respond, emphasizing that Serena Williams' ability to advocate for herself is what ultimately saved her life. Following the birth of her daughter, Alexis Olympia Ohanian, Williams experienced a cascade of life-threatening complications after undergoing an emergency cesarean section. Despite being an elite athlete with access to top-tier healthcare, her experience reflected the dangerous reality that many Black women face during childbirth. After the C-section, Williams developed blood clots in her lungs, pulmonary embolisms, and her legs, deep vein thrombosis, a condition she was already predisposed to due to her medical history. In addition to this, Williams endured severe coughing fits, which eventually caused her C-section wound to rupture, compounding her already dire situation. Williams has spoken openly about the terrifying ordeal that nearly claimed her life, sharing the details in a 2018 interview with Today. She recalled how, despite the mounting pressure of her symptoms, her concerns were initially dismissed by the medical staff. However, her persistence proved to be critical. Williams knew her body well, having dealt with a similar issue in 2011 when she was diagnosed with blood clots. Trusting her instincts, she repeatedly demanded a CT scan, which finally led the medical team to confirm her suspicions and discover the embolisms. Reflecting on the experience, Williams said, "I can't believe how much went wrong on the way to meeting her. I almost died." This story of survival wasn't just a personal recount. Williams used her platform to shed light on the systemic issues surrounding maternal health care, especially for Black women. In 2018, the same year she gave her interview, she also documented her traumatic birth experience in the HBO documentary Being Serena, offering viewers an intimate look at both her physical and emotional battle during that time. The documentary further highlighted how even someone as accomplished and globally recognized as Williams was vulnerable to the dangers of childbirth complications, especially as a Black woman in America. What makes Williams' ordeal all the more alarming is the fact that she had already informed her medical team that she was at heightened risk for blood clots, following her 2011 embolism. Despite her clear medical history and her own warnings, it took her unwavering self-advocacy to prompt the appropriate care and interventions. Her story has since become emblematic of the wider crisis affecting Black maternal health in the U.S., where Black women are disproportionately affected by higher mortality rates during childbirth. The disparity is not a result of individual choices or actions, but rather reflects a deeper, systemic problem in the healthcare system that overlooks, dismisses, and underestimates the concerns of Black women. Serena Williams' near-death experience serves as a stark reminder of the critical importance of listening to patients, especially Black women, and recognizing the inequities that exist in maternal health care today. Online reactions to the MAGA supporter Joel Berry came swiftly and in large numbers, as many pointed to Serena Williams' story to debunk his inflammatory claims. Users were quick to highlight the dangerous misconceptions his tweet propagated, particularly regarding the racial disparities in maternal health care. One tweet passionately stated, "The greatest athlete of all time is being ignored on the surgeon's table. Serena Williams almost died in childbirth. I can't believe y'all. The unmitigated gall." Tweet reflected widespread disbelief that someone as renowned and influential as Williams, with access to the best medical care, could still face such life-threatening complications, an experience far too common for Black women in America. Another user sarcastically responded to Berry's claim that Black women suffer higher mortality rates due to neglecting prenatal care and drug use, tweeting, Serena Williams nearly died because she didn't take prenatals and uses drugs? Maybe. It's his wife who may base her care on these assumptions. Studies actually show drug use is highest among the most privileged, but carry on. This response highlighted the irony and baselessness of Barry's claims, pointing out that social and racial disparities in healthcare access and treatment play a far greater role than individual lifestyle choices. Barry, who identifies as pro-life and insists he isn't racist, became the subject of intense scrutiny. One particularly pointed response questioned his wife's role in maternal health care, suggesting that with such biases, I wouldn't want his wife handling any black woman's pregnancy given these thoughts. This sentiment echoed widespread concerns about medical professionals harboring harmful stereotypes, which can lead to the mistreatment or dismissal of patients' concerns, particularly those of black women. A third user added to the conversation with a mix of sarcasm and outrage. It all makes sense. I mean, Serena Williams had serious complications in her birth experience, and who eats worse than the #1 world tennis player? Tweet underscored the absurdity of Barry's argument, driving home the point that Serena Williams, one of the world's most disciplined and physically fit athletes, nearly lost her life in childbirth due to complications that had nothing to do with her diet or lifestyle. Williams herself has continued to advocate for better maternal health care, particularly for women of color. In 2019, 2 years after her near-death experience, she helped raise $3 million for Mommy, a tech company focused on transforming prenatal and postnatal care for mothers and infants. Mommy aims to create an integrated care system that helps prevent tragedies like Williams' own brush with death by providing mothers with continuous care and monitoring throughout their pregnancy and postpartum period. In 2023, just a month before the birth of their second daughter, Adira, Williams' husband, Alexis Ohanian, spoke to people about their heightened vigilance surrounding her second pregnancy. We're obviously taking every precaution and doing everything we can to make sure everything goes smoothly for Serena, he said, though he did not elaborate on the specific measures they were taking. His comments reflected the lingering fear and concern from Williams' previous birth experience, a stark reminder that even the most celebrated and privileged individuals are not immune to the dangers of childbirth, especially black women. Amid the viral discussions about maternal health disparities, another tragedy was mentioned: the death of Amber Nicole Thurman. Thurman went septic after taking an abortion pill that failed to fully expel the contents of her uterus. Due to a lack of timely follow-up care from her abortion provider, Thurman died. This case, cited by online users, was another example of a preventable death due to failures in medical care, sparking debates about healthcare access, particularly in states like Georgia. Critics argued that Georgia law did not prohibit the care Thurman needed, pointing to systemic failings that extend beyond race and into broader healthcare shortcomings for women across the country.